First frustration I have over this whole healthcare debacle is um, the right wing conservatives, the far right especially, but even in the middle, um, are using propaganda to stir up their base and trying to increase their base with what I know to be lies. So I think the propaganda machine now is just so big, and there's no oversight on, or even any penalty if you go on a news show or you say you're a news show, or anything in the public and just spew those lies. As you're not a real journalist, then you're just um, one of those rag magazines that, say aliens came down and moved in with me or whatever. All the stuff that those you guys are putting out there that are lies, and you know it. Just stop, because you're really hurting the individuals that um, are on the Republican side, because they can't come informed. They just have this propaganda that they repeat because you've told them it's true. So I think it's just out of control. In the current environment today, if you have insurance through your employer, um, or on your own, I just want you to realize, and maybe this will be a surprise to you, that individuals in those insurance companies, people who their main goal is to be profitable and answer to their stakeholders, not the American people, but their stakeholders. So these individuals are right. You know, your doctor sends in does all the paperwork that you need an operation of something, and it goes to the insurance. They make the determination on whether you can have it based on criteria that some I can't figure out how they can do it, but they're like, no, we're not covering it because of some thing that they may have researched and found, um, which is just crazy. They shouldn't be able to, if you have the insurance, they shouldn't be able to um, not allow you to have something your doctor feels strongly about. Same with prescriptions for drugs. You know, that if you go to the pharmacy and you try to get a prescription from your doctor filled, and the pharmacist comes out and goes, oh, this isn't covered under your insurance plan. The insurance decided, and maybe along with your employer, the cost of it is just too much to incur, so they just disallow it. But you need that prescription, um, but you had to pay out of pocket. And one example, that when I was with an insurance company, I went to get a prescription, and the plan that I had through the employer, through a very well-known insurance company, is they wouldn't cover the specific drug, and it would have been for 30 pills $600, and it's something that you have to continue to take. $600 out of pocket, on top of you already paying your premiums and contributing to the cost for your insurance through your employer, or if you're just self-insured, you go out and get a plan on your own. So in today's environment, what you scream about, and what the Fox people scream about, is that the government's going to get in your business and they're going to know your health care. Quite frankly, right now, your insurance company is doing that. If you have insurance today, they are already doing that with no oversight. So when they say no, they mean no, it's no. And I just don't get how people don't realize that. And they're like, I don't want the government in my business, but sure, I'll let these insurance companies, whose sole goal is to make a profit and answer their shareholders, determine what care I get. That bugs me. And I don't get, I can't believe people don't understand that, and don't understand that the death panels in the government proposal, there's not any. Another concern that I heard voiced is the concern or fear of our taxes being raised to pay for the healthcare reform and the public option and so forth. And I just want to quickly try to put what I believe on it is that in the current state of if you have insurance today, specifically through an employer, what you have probably seen year over year is your coverage, your overall coverage has potentially decreased in certain, specifically on the drug side, um, and the quality of care has decreased while the cost of insurance has increased. The employers have to go out and pay the increase in cost for insurance in order to get it for their employees, but then they negotiate the structure of it. And so the insurance organization and your employer are determining what will be covered. And this changes year over year. There's usually 1-year contracts. So, and most likely in a person who is got employer sponsored health care, they have seen a increase in their expenses, in their premiums, and then lack of coverage. So I really think we'll find a savings in our own pockets on insurance, on the healthcare reform side of the house. So I think you'll save money because the increase in cost will start slowing down or hopefully go down, therefore decreasing your premiums, and you may be paying a little bit more in taxes, but I think it even balances and maybe you come out on ahead. So I'm not really sure why people don't think that through before they just go, are you going to raise my taxes? And I don't want it if you are, but what's happening to you today? And you can find that out. You can look back 5 years or more and see how the coverage has changed and how the costs have changed. So I'm just going to leave that at that. The last thing I'd like to cover is something that really has been a frustration for me over this whole discussion and debate is how the Democrats, specifically President Obama, are trying to reach across the aisle and come up with this health care reform through bipartisanship, which is a great idea because it hasn't happened in a long time. But it's frustrating because we continue down that, what appears to be continuing down the bipartisanship road, which is just getting in the way and helping the people that make the propaganda have more, and just really messing up the whole bill or proposal in my mind. The Republicans have stated on film and in written form on websites and stuff, they are not going to support any health care reform bill that Obama says is the reform, is his plan. They're not going to do it. They won't pass anything. So, to work with them in this frustration is just getting us nowhere, and it's going to delay or kill any hope for healthcare reform. I mean, when you have someone that's sitting on the Finance Senate subcommittee, which is bipartisan, with the Republicans and the Democrats, you have Republicans that are working on that bill and agreeing to specific, or negotiating and agreeing to specific parts, or even putting in some of the things that they want state on TV, out of their mouths, and all over the web, is that they won't support anything. So my hope is that we as the Democratic Party come together and get this health care reform done, regardless of bipartisanship, because it's not happening. Anyway, so that's my points on the health care thing. I have many more. Sorry this was long anyway. But please get informed about the issues and the impact to you and your family